Hi everyone, good afternoon. It is Dr. Prabakar and welcome to another episode of the TheFibroidDoc. Today I am going live and I want to talk about something that is an awesome treatment for bleeding and for those with small fibroids. And yet when I introduce it to patients or suggest it, it is met with so much resistance often in the office. Patients will immediately talk about, how their sister had it and it was horrible, and how their cousin, had it put in and their hair fell out, and, on and on about all these side effects from it. Now, I'm not denying that some treatments do have side effects, but the benefits of this particular treatment far outweigh, I think, in my opinion, any of the side effects or any downsides to it. So what am I talking about? I am talking about the IUD, or the intrauterine device. And so let me tell you a little bit more about it, okay? So the IUD, it comes in two forms. One is a hormonal one and one is a non-hormonal one. So for the purpose of our discussion, I'm going to talk about the hormonal one because that is the one that is used to treat abnormal bleeding from fibroids and or just, even without fibroids, it just treats abnormal bleeding in women. And I think it's one of the best innovations in modern gynecology. So when we talk about hormonal IUDs, we're talking about progesterone. Okay, so the only hormone used in IUDs is progesterone. So these IUDs do not have any estrogen in them. So you can either have a progesterone IUD or a non-hormonal IUD, which has copper in it. So for, again, today's discussion, I'm going to talk about the progesterone IUD. Okay, so this IUD, I'm going to show you an example of an IUD right here. So this is the uterine cavity, and this is an IUD, or sometimes it's called the T because it looks like a T. And it has these strings that you can see right here that hang out of the cervix after insertion. So it's actually a pretty long string that once I put the IUD in, I shorten it to about 2 centimeters. Okay, so this IUD sits in the uterus and helps really thin the lining of the uterus and prevents a massive shedding every month by keeping the lining really thin. So how does this help? It helps those who have very heavy menstrual bleeding, because of different medical conditions, or heavy menstrual bleeding because, specifically because of fibroids. So even if you have a couple of small fibroids in here, you can still use this IUD and it will really thin out your lining and help keep your periods very light. 50% of women don't even get a period after 6 months. How cool is that, right? So people with obviously busy lifestyles, athletes, college students, swimmers, who are really, their quality of life is greatly diminished by these heavy periods, this is really an awesome thing to use. And the non-hormonal ones, we will discuss it at a different time, but that one is mainly used for contraception, okay? So the benefits of the progesterone IUD, typically they go by the name Mirena or Skyla. These IUDs help with minimizing blood flow every month. They can also prevent, for some people, even prevent them from getting a period. Or maybe just have some spotting. And it's also really reliable contraception. Okay, so it acts as, you get many benefits with it. The insertion process is pretty simple. It's done in the office. It takes a few minutes. It's a little crampy. You can have a little spotting in the beginning, a little irregular bleeding for a couple of weeks, but the insertion process is very quick. I suggest that patients take a Motrin or an Advil or an ibuprofen for 30 minutes prior to the procedure because it is a little uncomfortable. But once it's in, it's done. And the most popular one today, the Mirena, you can keep it in for 5 years. So, you just put it in there and you forget about it, and it can really help with abnormal bleeding. So if you are suffering from abnormal bleeding, you've got little fibroids that are causing excessive bleeding, and you don't want to take the birth control pill or a shot, or a ring, talk to your doctor about this. The IUD, and especially the progesterone IUD, can really help you out, okay? So main points from today, the IUD can really help with heavy bleeding or irregular bleeding or bleeding from fibroids, okay? The progesterone IUD can last for 5 years or 3 years. And it is a simple office procedure to get it in. Okay, so this is all just medical information. It's not specific advice to you, but you can take this information and go speak to your gynecologist about it. Okay, so if you've enjoyed this, please subscribe and follow me on Instagram, and also subscribe to my YouTube channel, The Fibroid Doc. Okay, until next time, bye everyone.